Hello, everybody. My name is Ryan Henry. I'm with the Upper Cumberland Human Resource Agency's UC Recovery Program, and I'm here today with my friend Shane Farris from Volunteer Behavioral Healthcare System. And we're just going to talk about recovery and all the resources available to anyone that might be interested. And we'll give you more information about that later as we go. Shane, how are you?
Doing well.
Thanks for coming.
Man, thanks for having me. I appreciate it.
Yeah. So tell us a little about Shane and how you found your way to volunteer.
Oh, wow. So found my way to volunteer, found my way back to volunteer, actually. I started working with Plateau Mental Health, which a lot of our locals still know us by here in Cookeville, back in the 90s, and was facilitating some groups and doing some primary prevention work and working in our residential program at that time. That was 1998, 1999. And then started working with some other populations, staying in the social work, psychology field. And, my faith tells me that God had a plan and has brought me back to volunteer. And He did that through a lot of the other choices that I made, professional choices even. So, yeah. That's where I am today, back at where I started back in the 90s.
Yeah. You mentioned Plateau Mental Health, and a lot of our viewers that are in the area probably know that as where Volunteers Cookeville campus is. What is that, like a rebranding, or what's going on with the whole Plateau Volunteer?
So Plateau Mental Health started as more of an independent kind of mental health provider, community-based mental health provider, but then in the mid-90s, there was a movement among the MCOs and the insurances and the insurance providers where a lot of smart people, smarter than me, realized that mom and pop or smaller mental health centers were going to have a hard time making it. And so there was a coming together of several different mental health centers at that time, and that's where Volunteer was birthed. And we became part of a bigger program at that time, even in 1995, 96, somewhere around in there. And but at that time, everybody that joined just kept their original name, Plateau Mental Health. But as time has evolved, we know the importance of just being known across the state, because we, Volunteer Behavioral Health, we provide services in at least 50 of our counties in the state.
I didn't know that.
And so we found it important, as most folks will, that coming together as one through Volunteer, and that's one of our slogans, one team, one dream, was important. So we started really just focusing on that Volunteer brand, and that's what we try to be known as now. And so we're officially the Cookeville campus of Volunteer Behavioral Health.
Okay. Wow. What sort of offerings or services does Volunteer provide the community?
There's so many that I won't be able to name them all. So for people listening, I'm not trying to intentionally leave anything out. But so for a community-based mental health center, we offer at the Cookeville location medication management, outpatient therapy, care management, which is a big part of what we do. We also have intensive outpatient for co-occurring disorders, which is co-occurring is someone who has a mental health diagnosis as well as a substance use diagnosis. And I should say that we've got 21 locations throughout the state, and those basic services are offered in all of our locations across the state, 21 brick and mortars, if you will. But then 3 of our locations, we call them our hubs, Cookeville being one of those, Murfreesboro being the other, and Chattanooga being another. We offer those 24/7 programs, which encompasses the substance use and recovery. We also have crisis stabilization units and respite and observation as well in those 3 locations.
Wow. What do you think is the niche? What is it Volunteer does really well?
We treat the whole person. I think, is what we do, because we understand that regardless of what any of us are going through, whether it be mental health, whether it be substance use, whether it be just addicted to caffeine, whatever our issues are, we know that there's more to a person than just that one situation. And we build on a person's strengths. We try to help a person discover what strengths they have and help them understand and utilize those strengths in whatever recovery they need to undertake.
Yeah.
We just try to look at all those strengths and develop a treatment plan or a strategy around those strengths to help that person in whatever they're trying to recover from.
That's good. It's so easy to see the substance abuse or the mental health difficulties, depression, anxiety, as the whole thing, when really those are just tips of the iceberg, aren't they? There's so much more going on within that person where it's lost, that there's more going on below the surface than just these symptoms of the substance use, the mental health difficulties. And that's really cool to hear an organization care about the whole person. And I think that has been what's really exciting about our partnership with UC Recovery and Volunteer, is trying to help the whole person, whether there's housing, there's jobs, there's all the things that go into somebody's recovery. And Volunteer has been a really strong partner in helping with the crisis portion, with getting the person connected to whether it's medications, counseling, all the things that are needed to help somebody get a foundation in recovery. So that's been really neat to see.
A couple of things that you mentioned when you said the word symptoms. That makes me think of a lot of the behaviors that you see out of an individual, again, going back to whatever their diagnosis may be. Those behaviors are just symptoms of a deeper issue, and that's what we're trying to figure out, get to the bottom of that. And regardless of what those behaviors may be, that person does have strengths. A lot of times those have been lost through their journey,
right,
and been buried by some of those behaviors that they're trying to overcome.
Yeah.
The other word that you used was crisis, and I want to make sure I touch base on that, because as I was talking about our brick and mortar locations and the 3 hubs, those 3 hubs have 24/7 services, and our walk-in center in those 3 hubs is a big piece of what we do. It's a big piece with how we partner with UC Recovery.
Right.
And those are open 24/7. And a person can come in, regardless of what they're experiencing at the time, a person can come into that walk-in center and they're going to be greeted by someone who's wanting to help, who's going to do an assessment and try to figure out what the next step for them is, whether it is an admission to one of our 24/7 services, or maybe it's just trying to get them plugged into some of our outpatient services.
What do you think some common misconceptions about crisis would be? We hear crisis and you think the world's falling apart, but can you kind of elaborate on what that word crisis can mean to the multitude of people that you see?
The crisis varies with each individual, and it can even vary within that individual and the moments of that individual's life. What may be a crisis today may be very well handled the next day. So it looks different for everyone. And so, again, we meet folks at the door in a very non-judgmental way. And I've heard people say, well, I really don't need the walk-in center because my situation's not that dire, my situation's not that serious as of yet. But that's what we're there for. We're there to try to keep the situation from getting any worse from where someone may be at that particular moment.
That could be any time of day or night.
That can be any time of day or night. And not only do our crises differ, the support that each one of us experience in our daily lives differ. And a lot of times that can magnify the crisis, that can make a crisis worse if you don't have a lot of social support, a lot of family, a church family, a social support group to fall back on. That can make the crisis worse, but it certainly can help the crisis be experienced in a shorter amount of time or help us recover from that crisis if a person does have strong social support. If a person doesn't have a lot of the supports that you and I probably have in our lives today, that again can magnify that crisis and may need the 3, 4, 5 days away from the situation in order to better be able to manage.
Kind of like a reset, just to hit pause and regroup and figure out the next steps.
For our crisis stabilization unit and the mental health side of what we do, that's exactly what we try to do there. We're trying to intervene before it gets to the point where you're going to need more than maybe that 4 or 5 day reset. Now, when we're talking about substance use and treatment, as there's probably going to be, for a person to be successful, there's probably going to be more in-depth treatment that could be needed for that.
And do you help make arrangements, whether it's on campus or somewhere else?
Yes. Once they come into the walk-in center, they are ours. Now, we may not be able to provide the necessary service that they need at that particular time, and there's a lot of different elements that go into that. It could be the payer source, what kind of insurance, that kind of thing. Keep in mind that a community-based mental health is primarily for the uninsured or for folks who have 10 care providers, but that does not limit who can access our walk-in center. So once they come in, they are ours. And again, based on their insurance, we may need to start trying to get them placed at another location, but we will do that. That's what we're there for, is to help a person, anybody, jump through the hoops or make the phone calls that need to be made in order to get them help. I do want to emphasize that with our walk-in center, our crisis stabilization unit on the mental health side, that does not matter what payer source you have. That is a grant provided program. Anyone can access that walk-in center and that crisis stabilization unit at any time, regardless of payer source.
Anybody that has driven up and down South Willow around Gould Drive has probably noticed the last 2 years of a lot of activity and construction going on your campus. You want to share what's going on with all that?
Would love to share.
Yeah.
I got to tour some folks through there this morning, and that's just like another paycheck for me as I get to walk through that part of the building, because we are undergoing some renovations that is really, after the end of all the phases, we're going to have 70 beds available to treat people, whether that be through crisis stabilization or medical detox based on substance use and the level of care that they need at that time. But one of the most important things, for many years we were known for our residential program, and we suspended that a couple of years back for a couple of different reasons. But one of the reasons was for us to be able to expand. And when these phases are completed, we're going to have up to 32 residential beds available for folks. So when they come in for detox, if they will stay in the program, they're going to get 7 days worth of detox treatment.
Oh, wow.
But at the end of that 7 days, we know that for treatment to really be effective, it takes more than a 7-day detox.
Sure.
And so we're going to be able to offer up to 28 days of a residential program.
Wow.
And so folks will be able to come. It will be male and female, and they will be able to come to our residential program for up to 28 days and provide further treatment past detox.
Wow. That's really cool. That's pretty exciting stuff. What are some of the gaps that you see or have seen for either people coming to you or people leaving, or just in general in the whole addiction treatment recovery realm? Some of those gaps or missing pieces.
Well, one of the missing pieces, that regardless of what meeting you are in the Upper Cumberland as it relates to social work and the kind of things that we do, recovery work that you do, and let me just say that UCHRA and UCDD has helped with this tremendously, but that's just the transportation issue. A lot of our folks live in the Upper Cumberland in rural areas, very rural areas, and getting them, there's a small frame of time when a person reaches out for help that we have to really be able to act on at that moment, because sometimes that is passing. And so if they cannot arrange transportation at that given moment, sometimes we lose those folks, and it may be a while before we get the opportunity for a light bulb to go off in their head that, hey, I want treatment. So transportation's a big deal. Again, thank you for y'all's program. UCHRA and y'all's CPRSs bring folks to our walk-in center on a regular basis, and so just the shuttle program that y'all have has been tremendous. I think another gap in recovery that is really missing, and for folks that come into recovery, one of the things that, whether they're on probation, whether they're not on probation, once they leave, they need employment. We all need a paycheck at the end of the day in order to provide for our families, provide for our loved ones, and just to live. And there is such stigma even around mental health, but as substance use and recovery as well, that a lot of folks choose not to employ folks that are transparent with their issues.
Yeah.
And unfortunately, a lot of times that's what will set people back, because as they are trying to find a place to live, as they are trying to find a way to pay their bills on a weekly basis, if they are stigmatized in such a way that they can't find employment, then that's really going to limit who they can fall back on. And in so many cases, a lot of folks have burned bridges to the point that they only can fall back on who they know. And that's not always positive for a person in recovery.
Yeah, that is sometimes an overlooked piece, is employment, and how that instills in somebody purpose, and they learn how to be trustworthy. They're given responsibilities to provide for their family and be a productive member of the community. That sometimes can be an afterthought, but being able to give somebody an opportunity to get sober, to get their mind calmed, and then work their way into a job, into a career, that's a huge boost in self-esteem and confidence that I think gets overlooked a lot of times. And just in my own experience, we all want the job that's down the road, that's making $30 an hour, but just getting a job and learning those skills of how to be a good employer, trying to educate, our clients all the time, trying to educate. Just get here, start somewhere, and then work your way up. And then some of that is encouraging policymakers, HR departments to take a relook at their policies, to how can we create a cleaner way, less barriers for somebody to get employed here, and give them a shot at making a life. That's top down there.
Absolutely. You mentioned the word purpose, and I firmly believe that everybody that's here on this earth has a purpose in life. And we all run into hiccups along the way. None of us want to be judged based on the worst thing that we've ever done in our life. Right. None of us, right. Regardless of where we are today. But folks have put themselves in a situation where a lot of times when they leave treatment, they are still being judged. Most of the time, they are still being judged at that moment based on the worst mistake that they may have made, or maybe even mistakes that were not their fault to start with. And so I think, again, job, employment, that just starts feeding back into a person's true purpose for being on this earth. And that's why we do what we want to do. We want to give purpose. We want to give hope. We want people to just being able to give back, and that's just a piece too that just adds to their recovery.
Yeah. How has fentanyl and gas station drugs, has it or is it changing the landscape in addiction and mental health treatment?
It's changed it tremendously. It's really, I mean, it's really two different things when you talk about fentanyl and then you talk about the gas station drugs, gas station heroin. It goes even further than just the kratom or but just the CBD and all of that. So one thing, since fentanyl has appeared, one of the sayings that I don't necessarily like and that I don't use a whole lot anymore is that relapse is just part of recovery. We can't say that anymore with certainty, because today relapse can certainly be the moment of death, and fentanyl is the reason behind that. And it's just changed the whole landscape again, like you said. It's just, I think, brings the importance of good quality treatment to the top. It brings the importance of the whole community becoming involved, because as fentanyl has reared its ugly head, more and more families are being involved in such traumatic ways. And you know, so there's that.
Yeah,
the,
I mean,
the whole fentanyl piece, you're talking about immediate death.
Yeah.
And then the gas station heroin, over-the-counter things, and most of the time, a lot of the time, these things are geared toward our children by the way they are packaged, the flavors that they use, all the different things. But these are not safe alternatives to fentanyl or safe alternatives to the marijuana you might buy off the street. These are very dangerous drugs that are as addictive, sometimes more addictive, because of the ease of being able to go in and buying it across the counter. They come with the same addictive substances that fentanyl or heroin or any of the other things come with. And we're seeing an increase of people that are coming for detox just from those gas station, convenience store, tobacco shop kind of buys. And another piece of that is they can create psychosis in a person from a mental health standpoint that a person may never have experienced before they used that. And it's very scary. And you know, I've from a personal standpoint, I've tried to start limiting where I buy my gas and spend my money at places that do not sell those things, and that's getting harder and harder to find, because the lobbyists behind those products and the money behind those products, the countries behind those products, are pushing them to a degree where there's so much money in it that a lot of people are getting into the resale of those things.
What are some of those gas station drugs? You mentioned a couple, but do you have?
I don't have a list right here in front of me that I could go to. I know kratom is the big thing right now. Yeah. And there are a lot of folks that will say kratom will help certain situations, certain mental health diagnosis, even to a degree. And I don't have studies in front of me that could debate that at all right now. What I would say is that if you're going to try any of that, you know, we've heard a lot in the past several years about the medical necessity of marijuana and THC and how that can help certain things. If you're going to try that, go through your doctor. If you're going to do anything that we are finding that people are pushing across the counter, go through a professional to do it in such a way that's safe, and not just by trying it because it's across the counter and you've read an article, or you have a friend that said, hey, this helped my anxiety a lot, this helped me sleep a lot. All of our bodies are different. We react to things in a different way. So whatever it is, and there's a whole lot of times aisle that is in a store with different flavors and different things that you can put in things that may seem as simple as vapes, but it's killing people, and it's causing psychosis in people, and it's causing addictions in people. And again, the more these things spread, the more each one of our families can be affected. And a lot of us can look and see how our families have been affected by mental health, by substance use, and this is just another way that's going to bring that closer to our homes if we don't rise up and try to fight it.
If you could wave a magic wand and have your hopes and dreams come true for the addiction treatment recovery community in the Upper Cumberland, what would that look like?
You've asked me that question before, and it changes about every time. I've done a lot of reading about just the ecosystemic recovery plan that a community has. If I could wave that wand today, as you said, it would be a better educated community in what each one of our roles in the recovery process is. I don't think there's anyone in our community today that does not have a role in helping people recover from whatever their issue, whether it's a mental health issue, substance use issue, or whatever, hurt, hang up, whatever you want to call it. Every one of us, to make our communities safer, to make our communities healthier, every one of us have a role in that, whether it be as an employer, whether it be as a friend, whether it be as a social support, whatever that role is, we all have a role. And if we could educate our communities to understand that this is not a problem that affects people on that side of the town or people on this side of the town, it's a problem that affects our community as a whole from doing even greater and mightier things. That's what I would wish for. I think UC Recovery tries to do that. UCHRA tries to do that. VBH, Volunteer, we try to do that. And we do. We have great partners throughout our community. And Upper Cumberland is at such a better place today than we were 30 years ago when I started. But there's always work to be done. So that would be my wish.
Yeah. What's one thing about Shane Farris that can't be found on a website bio or a resume?
I'm just one of us. I mean, it's just, we're all alike. Yeah. I tend to think, so I could say that, I play a little bit of guitar, or I write a little bit of music. I could say things like that. But I choose to say that we are all more alike than we are different. And so there's really not a whole lot out there that differentiates me from you. Yeah. You've got a little bit more darker facial hair than I do. So I just choose to say that, I'm out there struggling on a day-to-day basis. I'm blessed because I have a great social support system behind me. I have a great faith-based system and great internal faith that helps sustain me, great friends. Yeah. But yeah, there's nothing unique about Shane Farris that I can think of.
I think you're pretty unique. Do you have any final words or shout outs you want to make?
We just have so many partners that make it possible for what Volunteer Behavioral Health does. Again, UCHRA and you folks and all the people that you have throughout the Upper Cumberland is great. We have all kinds of partners like that. I just need to mention the State Department of Mental Health and Substance Use Treatment and Recovery. They have been great to work with. They do a lot of funding, not just for volunteer behavioral health, but across the state for all kinds of agencies that do what we do and do similar work. So a big shout out to them today. Our current governor has taken what we do to a whole different level. Our Commissioner Williams, the commissioner of the Department of Mental Health and Substance Use Recovery, has been doing this job for many, many years. And Ryan, you would probably say in the period of time you've been doing this, never before, and a lot of this is through the state, but a lot of it is the opioid abatement monies that's available now.
Yeah.
Never before have we had the opportunity to have as much money poured into what we are trying to do as we have, and I've been doing this for 30 years again. My hope, my prayer, my belief is that in another 30 years, all this money will not have been put into the system for nothing, that lives will be saved, lives will be affected, and that there will be more and more people coming up behind us doing what we're doing, but there'll be less and less need. So
that's good.
Yeah, so you can always go to our website, www.vbhcs.org. There's all kinds of contact information there. We can also share our 1-800 number. One of the things that we do is called No Wrong Door. So you can call us, and the same day that you call us, you're going to get help. You're going to get medication management if that's what you need. You're going to get to talk to a therapist within 24 hours or care manager within 24 hours, or you can come into our walk-in center at any time 24/7 and get the help that you need.
Thank you all for watching, listening. Thank you to Shane Farris and Volunteer Behavioral Health for coming out and sharing about what they do. And UC Recovery, we believe that recovery is possible for all. If you or someone you know needs help with getting into treatment, with getting recovery resources, visit uchra.org.